Let me just say a chant really quick. नमामि धन्वन्तरिं आदिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरारुग्भयमृत्युनाशम् धातारमीशं विविधौषधीनाम् ॐ गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरुः साक्षात् परं ब्रह्मा तस्मै श्रीगुरवे नमः. All right. Admitting others also. Okay, good. Welcome, Karen, Debanti, Janelle. All right. So today's topic is about Panchakarma. It's interesting. I don't know if I told you all about this incident that I had a few weeks ago. This is something that that's the reason that I'm doing Panchakarma also today is I've had this call from someone and they were asking if I can do Panchakarma. And I was like, okay, what are you looking for? And the reason I asked is because in the United States, there are so many different varieties of Panchakarmas that are being done. And I wanted to know if he has done Panchakarma before. And what kind of Panchakarma are you looking for was my question. And that instigated this person. They're like, what do you mean, what kind of Panchakarma? There's only one kind of Panchakarma. Okay, all right. But I'm just looking, have you done Vaman, Virechan? Even though there are five different kinds of Panchakarma, we never do all five. It's not indicated to do all five ever. Either Vaman, Virechan, Basti, something was done. And then the person got instigated even more. Like, what are you talking about? Pancha means five. Karma means action. You have to do all five. What kind of practitioner are you? You're supposed to do all five of them. If you're doing only one, it's called Eka Karma. Why are you even calling me Panchakarma? At that moment, I said, Sir, I don't think I'm capable of doing this. I think you should look for a different practitioner who's able to do this, right? So it was hilarious how the conversation went. But then that's why I thought that it is important that we talk about Panchakarma. And this is something that I get all the time. I want to get Panchakarma done. So, with all of that, what do you guys know about Panchakarma? What do you think you know about Panchakarma? I know some of you have done Panchakarma in the past, some of you have experienced it. So, you know what it is to an extent. But what in your opinion is Panchakarma? If anybody wants to say it, just so that it's a little bit of interactive. If not, I can just start and say and give my spiel about it. Detox. Okay, good. Panchakarma is a detox. That's true. It's true to an extent.
I just thought that there was okay, I mean, I've read about it. The thing that stood out to me was bloodletting with leeches that used to be done, right? So I know that bloodletting is a part of it. So I'm like very curious as to like how modern takes look at that part of it. But yeah.
Absolutely. And I have to tell you that it is still a part. It's not used to be. I can still do it. I'm trained to do it. I have done it, but we're not allowed to do it here in the United States. But there is a leech clinic in Milpitas, which I send my clients to because it's a very important part for some of the treatments, for some of the conditions. So I do send them out. Yeah, it is one of the karmas. A way to rebalance the body and to detox, correct cleansing of the body, correct. Yes, so you're all correct to an extent. And so pancha, again, like I started with, pancha is five, karma is action. So panchakarma is a way to remove the toxins that have been accumulated in the body in a skillful way. And of course, when you're doing your food every day, you're eating your food every day, you have your bowel movement every day, you're cleansing every day, you're detoxing every day. How different is panchakarma? because the detox is happening every day via urine, feces, and sweat. And extra for women is menstruation. So these are the ways that detox is being done on a daily basis. Then why Panchakarma, right? So, for us to answer that question, let's go back to what is it that happens on a daily basis? What is it that we're exposed to on a daily basis? Like today, it's raining,
Mhm.
and Baijanti has said that I ate a soup. How many of us are able to, get a soup on rainy evening and, eat according to what is happening outside, eat according to what is happening outside, and eat according to what is happening inside. Most of the times we're like, oh, well, this is present in the home. Let me just finish it off. Let me just eat it. Can also happen. So, in that way, we're accumulating a lot of unnecessary toxins, unnecessary waste products, which are not being processed fully. Now, what happens is when we eat food, we spoke about this, that when we eat food, the food breaks down. And after it's broken down, it is formed into tissues. New tissues are formed. And then there is waste. So after the waste is formed, that remaining, after the tissues are formed, the remaining waste goes out via urine, feces, or sweat. Yeah? It's a neat and clean system. However, there is something called toxic metabolic waste, which means, if you're cleaning a house, if you're cleaning your house, Diwali is coming, some of us are cleaning our houses, and then we're like, well, I have not used it for the past 3 years, but I might use it in the next 1 year for sure. And you don't throw away a lot of stuff, and they accumulate in your garages, in your basements, they do accumulate. So these take up your real estate in the house. That is exactly what's happening with your AMA, with your toxic metabolic waste. Your body is not recognizing that it can change into waste or nutrition. It's not determining, it's not able to determine, it's in between. So it's not going out as urine, feces, or sweat, or it's not absorbing to become tissues. It's just in that middle ground where it is a toxic metabolic waste and that converts. And when that conversion is happening, your body does not recognize how to process it. When the processing is not able to be recognized, then the pro inflammatory factors or inflammatory factors are released. That is when you experience inflammation either in the form of skin conditions, in the form of itching, in the form of allergies, allergic rhinitis, headaches, migraines, constipation, lethargy, not able to sleep, insomnia, body aches. So many of these different conditions and symptoms are seen because of these mischievous toxic metabolic waste that is staying inside the body and not knowing how to process. Does that make sense? Is this all clear right now? How the toxic metabolic waste slowly comes, and now next time when you're trying to get rid of something, make a decision. You're cleaning your house, make a decision. If you have not used for the past 3 years, chances are you'll not use it again. So get rid of it, right? So that's how your body gets to accumulate all of this. Now, when you accumulate a lot of it, it's like a heap. Then you go to a Ayurvedic doctor and they give you a diet and lifestyle. Now you're not accumulating anymore, right? But what's going to happen to all of this that has already accumulated? You can be given shamana dravyas. You can be given, langhana, which is intermittent fasting, where we can tell you, eat at this time. Don't eat at this time. When you're eating, eat this particular things. And we can tell you exercise. And we can also tell you what time you have to exercise, right? So we give you all of this diet and lifestyle, which kind of allows to convert that ama in a little bit, cajole it to get it out of the body. But the way it is going out of the body is, imagine you have a big sand pile and you're taking just one grain at a time, that slowly it is going out of the body. Who has that much of a patience, right? I've had someone who had fibromyalgia come into clinic today, and they've been on pain medications, different level of pain medication for the past 30 years. And if you're that much of accumulation has happened in the body, no? Now I cannot say I'll just give you diet, I'll just give you lifestyle, you just be patient. Most of the time, by the time they've reached our clinic, they're already their tail end of their patients. They've already got, the patients is not even there. All right. So they don't have any more patients. In that situation is when I say, okay, now I cannot squeeze everything out. Just because you have fibromyalgia for the past 30 years, I will not play just a magic wand and say I will detox and I'll bring it out. No, because if you have, imagine it as an unripe mango. And this is an example that's given in Ayurveda as well, in the Ashtanga Hridayam as well. Unripe mango, if you try to squeeze unripe mango, what's going to happen? Unripe mango, if you're squeezing, you're just destroying the mango. Nothing is coming out. You'll not be able to eat it, because you're not cutting into pieces. It's not coming out as juice. You're just destroying the fruit without having to be able to eat it properly. That's exactly what happens if you do Panchakarma for people without ripening the doshas. Very important. A lot of times we always think that which Kerala center should we go to? Which I want to just go to Kerala, just get my detox done. I just will do my reset and I'll come back home. And that's like a magic wand, is what a lot of people think. But I have seen a lot of times that people come back from all of these Panchakarma centers with with their symptoms aggravated also sometimes. Of course, people whose symptoms are aggravated only will come to us. They will not come to us if they're not aggravated. But that also happens. And I'll tell you why. I'll come back to why that could also happen, right? So, the first thing that you have to remember is you have to convert these unripe toxins into ripe toxins so that you can smoothly, yes, good question, Karen, and we'll talk about it. We'll talk about how we're going to ripen the doshas. We're going to be ripening them and then slowly squeeze the juice out of the mango. That's how you have to send it out. If not, your doshas and your dhatus, your toxins and your tissues are like this, right? Your body cannot recognize. And if you're trying to just squeeze it out, you're going to create a kind of damage in your tissues. You don't want to happen. You don't want that to happen. And that's exactly what happens in your juice detoxes, in your coffee enemas, in coconut detoxes. I mean, God knows how many different types of detoxes are there, right? So, of course, when you do these kind of detoxes, you are going to remove the toxins. They are going to come out. You're forcefully removing the toxins out, leaving a damage on your tissues, and then you'll start becoming weak. You will not know how to recover from that weakness as well. Chikitsa treatment is in such a way that you should not create any kind of damage to the tissues. You should not create any kind of damage to the health of a person. You cannot, a client cannot choose whether I want health or whether I want this side effect, right? So what, like Karen was asking, how do we ripen the doshas? We find out, if I can take an example of what happened just today at the clinic with the fibromyalgia, and that has been there for 30 years. I have to give certain type of medications or herbs called Pachana and Deepana. I can write it down here, which means I'm going to give certain kind of herbs, especially they are going to be bitter, pungent, and some astringent as well. These qualities of herbs are given so that the doshas are slightly changing their color, and they're going to be ripening, and they are going to be removed from the dhatu. So there is going to be a layer that is created between the tissue and the doshas. These herbs have the tendency to just remove these doshas. And another thing that we also do is to allow for these doshas to flow in a particular direction. A lot of times they're all stuck. They're all stuck, stagnated in a particular area. They're either stagnated in your knee, stagnated in your joints, stagnated in your abdomen, in your intestines. They can be stagnated in your lungs. So these doshas can find a vulnerable spot in the body. So if they're present in the knees, let's say, if it's a rheumatoid arthritis, if it is present in the knees, how are you going to take it out, like squeeze it out of the knees? No, it's not possible. So you're going to be cajoling. It's like that nagging child who we took for shopping. You have to be skillful. You cannot, I mean, in India, you can slap. That's possible. In India, here, we cannot do that, no? So you have to be skillful and you have to be able to tell them, what did you want? Is this what you want? You have to make them happy. Only when they're happy is when you can go shopping happily. That's what you're going to do to your doshas. You cannot slap the doshas, say, okay, I'm going to just take you out like that. You have to be slowly cajoling it with this pachana dravyas, with the particular herbs that we give, and bring them to the nearest koshta. Koshta, I'm going to just write that term also here. I just want you to be familiar with these terms as well. Koshta is the digestive, it's like a big canal that is present in your body, the big alimentary tract, either in the upper abdomen or the lower abdomen. It will come depending upon wherever it is closer to. Once it comes to that area, then you can either vomit it out or you can create loose stools. So there is orifices that are closer to bring it out of the body. So that is what is going to happen. You cannot be, so the first day that they come to the clinic, I cannot do any Panchakarma techniques. I can do Upakarma. There's a very, very different understanding that is there between Upakarma and Panchakarma. And there's a lot of confusion. I get these calls also. People say that, I got my Panchakarma last time. I want to do the same Panchakarma again. Okay. How did you get your Panchakarma last time? I got 7 days straight of Abhyanga, Svedana, Shirodhara, and I was eating khichdi diet. And at the end of it, I did, I took 10 ml of castor oil and I did a purgation. That, my friend, is only a Shamana. It is not Shodhana at all. It is not Panchakarma at all. That is just a preparation process. It's Purva Karma, actually. It's preparation of the body. It is not a Pradhana Karma. Right? There are different stages that is present in Ayurveda. Now we're talking about Purva Karma, how we're preparing the body so that you can ripen these doshas and bring them out of the body easily. I remember one time we were doing this to one of the client. We were doing Abhyanga. We did Udvartana also for that client actually during that time. She said, in India, we give these offerings to goddesses. Animals are given as offerings. In olden days, they used to give animals as offerings and they would anoint the animal. They would put turmeric on the animal and they would give it as an offering. The client felt that we were doing the same as if we were doing her as an offering, right? Because we were applying everything, we were doing everything for her, and then at the end of it we were doing vomiting for her. We had to do vomiting for this client. So this purva karma is very important so that the doshas come to the closer orifice. That is what it's done. So in the purva karma, what happens? We do something called rukshana. Before all of the rukshana, we said we do pachana and deepana, which is changing of the doshas from their own nature so that they come to the nearest orifice. Once they come there, and once we determine, and how do we determine? We know that this person is pooping well, we know that this person is sleeping well than before, the pains are much less than before, energy is better. So these are all the things that we have to consider. Their energy must be considerably good for them to go through Panchakarma. If not, we cannot do it. It's a contraindication. Yeah. So then we're like, okay, now you're ready to go through Panchakarma. What we will do is we will do something called Rukshana right now. And it's still in the Purva Karma form. In the Rukshana, what happens is drying, drying of the tissues so that it is able to absorb the oil or ghee that we're going to give later on. Yeah, we give 3 days of diet where you don't eat any oil, ghee, milk, fruits, anything that creates any unctuousness in the body. So that is 3 to 5 days. Then we determine that this person's received some level of dryness. We look at the skin, we look at the hair, we look at stools might be a little constipated than what it was before. Then we know, okay, you've reached a stage. And then again, this is a little different because for Vata person, I'll probably have to do only for 2 days. Within first 2 days, this person is like restlessness. What are you doing to me? I'm sleepy. I cannot even sleep at all. I'm restless all the time. I'm super constipated. Then I have to stop in 2 days only. For a Kapha person, I might have to be doing for 5 days. Because even at the fifth day, I will not see the dryness in the skin. So I have to determine what is the quality of this person and then determine how many days of dryness is done. Then comes the Snehapana, which is Snehapana. Here we ask you again, these two, sorry, I first have to tell you what are all the, okay, can anybody tell me what are the five Panchakarmas that are there? Before all of this, I should probably ask you a quick quiz question. What are the five karmas that are present in Panchakarma? I hope someone is able to answer. Nobody? Nobody?
Do you mean the five elements that fire?
Not five elements. So Panchakarma is a 5 ways of detox. 5 detox methods.
Oh,
What?
drinking of water?
No, 5 detox methods that are done.
It's like vomiting, right, is one of them.
Vomiting is one of them, correct.
Therapeutic sweating, one of them.
Therapeutic sweating comes under Purva Karma. It is not a Pradhana Karma. It's not the main one. Vomiting is
Bloodletting.
one. Yeah, enema is one, Janelle, correct. What else? Nasal, Nasya is one, correct, Karen.
Vamana, Virechana,
Vamana, Virechana,
bloodletting,
bloodletting,
mm,
and then the other two are written here, Basti and Nasya.
Asti and Nasya, yes.
Very good. So I'm going to just write that down here first. Vamana, Virechana, Basti, Nasya, and Rakta Mokshana. Okay, so these are the 5 ways that toxins are taken out of the body. We can do one of them, two of them, or three of them. Never 5 of them are done. It's all very, very rare that all 5 of them would be done. I mean, if all 5 of them would be done, you have to take at least 3 months off. You have to do all 5 of them, right? So these are the ways of removing the toxins that are present in the body. Now, if you have to do something called a Vamana, we're talking about Vamana or Virechana, the ways of doing Vamana and Virechana at our clinic. We spoke about Pachana and Deepana, where we move the doshas from one place to another place where we can easily take them out of the body. And then we do Rukshana, which is drying. Then now we're at Snehapana. Are we all on this? Are we all following this sequence? Am I confusing you? Yeah, good. Okay, good. So then when you're doing the Snehapana, Snehapana can be done either with ghee or oil. Medicated ghee or medicated oil is given. Why is that? Anything that is lipophilic is going to be absorbing the toxins very, very well. If you have a gunk in your in any of the vessel, pour oil in it and it can easily remove that gunk. If you, I mean, the oiling anything is going to be absorbing the gunk and removing it out of that vessel or container. You've probably experienced it. If you have not, you can do that experiment yourself. So when you do that, when you give this medicated ghee, the first day you start with a test dose. At 6 in the morning, we ask the client to take 30 ml of medicated ghee. And then we ask them to wait and report to us how they're experiencing. You know, are you experiencing any ghee burps? Are you digesting it okay? Are you experiencing any headaches? Is there any loose stools? What time are you experiencing your hunger? So we do all of these. Once we know all of these, then we determine what the next dose is going to be. So, for example, if they take the 30 ml at 6 a.m., and if they're hungry by 11 itself, then we say, okay, tomorrow I want to give you 60 ml so that you will be hungry by 12. Then I increase it by 90. Then I increase it to 120, to 150, again, depending upon all of these factors. So, medicated ghee or oil means, Karen, ghee is processed with certain medicines, with certain herbs. There are many herbs that are present in Ayurveda, and the ghee is processed with that particular herb depending on the condition. We spoke about many conditions. We spoke about neuromuscular conditions, we spoke about skin conditions, we spoke about allergic conditions. Depending upon what the quality of this particular toxin is, we have to choose that medicated ghee. If it has to cross the blood brain barrier, let's say we're taking care of anxiety, depression, or any schizophrenia, or any kind of thing that the oil has to cross the blood brain barrier, we want to choose the oil which is medicated with brain tonics so that it can go there and it can remove the toxins from your skull region, brain region. Or you have to, if you're taking care of asthma, let's say chronic asthma, then you have to take care of the medicated ghee that has the tendency to go to your lungs. So you have to choose a particular, you have to choose the medicated ghee, you have to choose the medicated oil in such a way. And you increase the dose every day. And naturally, the first day, when they were hungry at 10 a.m., because they took only 30 ml the first day, then the second day, they'll probably be hungry at 12 p.m. Third day, they'll probably be hungry at 2 p.m. Then 4 p.m. Then 6 p.m. So their hunger will be changing because their dose of ghee is increasing every day. Dose of ghee or oil is increasing every day, and their body has to digest it. While this digestion is happening, what is happening? This oil layer is creating a barrier between your toxin and tissue. A nice barrier is created. So imagine all this accumulation that's there within the toxins and the tissues. There's a nice barrier that's now created and they're separated now. By this time, we see clients are they it's a body mind cleanse. They experience a lot of change in their mood behavior. We try to ask them to take off if possible. Even though you can work from home, it's best that you take off. The mood is changed and their hunger levels are changed. They feel nauseous. There could be some loose stools because the toxins are trying to go out somehow. And then we give them either 1 day or 2 days gap because we want them to recuperate their energy for the actual Vamana or Virechana day, for the actual day where we're creating vomiting or purgation. Most of the time, purgation is created. Then, so 5 days, 5 to 7 days of Snehapana, 2 days of Virama, which is break days. And then it comes to the Pradhana Karma. So this suggests that individuals should be healthy enough to handle Panchakarma. So is it more indicated for relatively healthy individuals for preventative purposes? So absolutely true, Devanti. This is indicated that individuals must have strength to handle Panchakarma. I would not say healthy enough to handle Panchakarma, but they should have strength. So the indication that was given by the acharyas is definitely for preventive purposes. But a lot of times we get clients who are experiencing any condition, like I spoke about fibromyalgia, rheumatoid arthritis, all the conditions that we spoke about. So we go through at least 2 to 3 months of shamana dravyas, that pachana and deepana, that we give for 2 to 3 months about. And we wait patiently to make sure that they have enough energy and they have enough capacity to go through all of this. It is like a surgery. I tell them it is not easy. It's not a spa kind of a procedure where it's like a fun kind of an experience, because a lot of people feel that way. So I tell them ahead of time that this is not something that you want to do it for fun. It is something that is very, very involved. And sometimes it could take 2 to 3 months to get the client to this particular stage before we even do anything. Yeah. So that's why I wanted to create that awareness where people want to fly in to different places, Bali, India. There's so many places that people fly into. And they ask me, how many days do you think Panchakarma is? I don't know. I never know. And this is the reason I never know, because I never know how the body is at this point and how it will respond and how I need to change it to. So now we're doing the Pradhana Karma. On the Pradhana Karma day, we give medications. Again, all these medications are changed according to what we are dealing with, because acidity or rheumatoid arthritis or IBS, it has to be different medications that we give to remove them. So the virechana that can happen, and they have to be in touch with us throughout the day. We give them, the Snehana and Svedana, which is medicated oil massages and sweating in the morning. And then by 9 a.m., we give them a medicine to take. The whole day, there will be loose stools. And this is how that layer created between the toxins and the tissues is easily coming out of the body. And yeah, so that's when we remove all of this out of the body. They might get at least 20 loose stools, 15 to 20 loose stools, and you'll be surprised. And this is something that a lot of people report, that in spite of having so many loose stools, they don't have dehydration symptoms, where there's dizziness, loss of consciousness, and disorientation, thirst. Nothing happens. And in fact, after having so many, they are feeling very energetic, and they feel like they have lots of energy at the end of the day, in spite of going through all of this, because they're removing their long-standing toxins that have been bothering their body for a long time. So that is happening. And with Vamana, we give dravyas in such a way that you have to vomit out. It's like 7 to 8 liters of medicine that is prepared, and we give it. And it's a fun thing when one time I had to ask my son to accompany me when one of my therapists called in sick that day, and I cannot stop Vamana. So I had to ask my son, this was, I think, 4 or 5 years ago. And he said, now I know how you earn your money, by making people puke. So yeah, but it's fun to see people get better, and how they get better. So that is Vamana and Virechana. These are the first things. That's what Panchakarma the first two things of Panchakarma, two methods of Panchakarma. If you don't have any questions about Vamana and Virechana, then we can move on to the next one called Basti. Any questions, or is this all going above? I just wanted to give some clarifications on Panchakarma, but has this made it any clear, or has this confused you? No questions from Karen. Okay.
So I guess I have a question kind of related to the one that I asked in the chat, which is for those individuals that are pretty sick, right? Like, I mean, Ayurveda seems to work very much on a principle of preventative
Hmm.
solutions, right? But there are individuals that get very sick. But
Hmm.
for them, this is not indicated. So then what would you do for them? Is it prepare them first to get strong, then do Panchakarma? Is that kind of the way of
Correct, correct, Devanti. So we do get a lot of clients that way as well, unfortunately, where they cannot even get Panchakarma done. And for that, the next one, Basti, is a easiest procedure actually compared to the Vaman and Virechana, because Vaman and Virechana is actually very, very difficult procedures. It requires a lot of restrictions and removal. So there are clients who come pretty sick actually. They could be uh, Parkinson's, and there could be Alzheimer's, and there could be in a wheelchair where they can't even walk, and severe debilitative stage of arthritis. So these are some clients that come to us. For them, what we do is we do shamana. Shamana is, I'm going to just write it here. Shamana is again giving pachana and deepana dravyas, which is giving them herbs in such a way that the doshas are moved from a location to the easiest location for them to go out through urine, feces, and sweat. So we are moving it into the what we call the Purishavaha Shrotas, so that it goes out via the feces easily, or it can go out via the urine easily. So that's how we have to move the toxins properly. And we have to assess and analyze whether they can handle it, because we have to look at the risk versus benefit. It's like I said, it's a surgery. And if we do a surgery without looking at the contraindications, we will be hurting them than helping them. Now, a lot of times people say that don't do it this extensive. Let's just do, just do, like a 3-day panchakarma, is what they say. Now, there's going to be contraindications for doing a 3-day panchakarma also, because you're just tickling the doshas, saying that I want to send you out, and then not everything is going out. It's like you starting to clean your Diwali, your home for Diwali, and say that, oh, I'm tired. I'll just do this much, and you leave it in a mess. When you remove everything out, and you just clean only 30% of it, and you leave the 70% out without cleaning it fully, then that's a mess you've created even more mess. So what we do is we tell them that we have to do this shamana for maybe a year, maybe 2 years. You will be on a maintenance mode only, because you have come and you are this sick. We don't want you to be even more sick, and we will strengthen you later. So maybe it's going to be shamana to a level, and we give them rasayana. And if we see that they are getting better, then we can move them to shodhana. If not, they will probably stay a lifelong shamana only, if they're coming to us in that stage. And we do have clients like that. And we say that it's not, and especially with even kids younger than even 12 years old, with especially autism, and kids that come with cerebral palsies or any of these conditions, it's not easy for us to perform all of these. They will not be able to support us with all of this. So we have to be doing shamana, and in that case, we do a lot of upakarmas. So that upakarmas is what we do. Escape upakarmas. Here we do a lot of oil massages, sweating, steam. We do external bastis, pouring a dam on that area and pouring oil. Or we do a lot of potalis, we beating with svedana, external svedanas, or bandhanas, or pichus. So these are all the upakarmas that we can do to make them, satisfied. Pinda sveda is also something that we do, where we make a potali with the rice, which is cooked with medicated milk to nourish them. Right? So many different ways. We do get eating disorders, right? When a client comes to us with eating disorder, we cannot do panchakarma for them. They're already frail, they're already weak, they don't have nourishment. So we have to be giving procedures in such a way that we are strengthening them. So that is why I wanted to give you an explanation of. I'm glad that you're asking this question. That means that I would have reached you to an extent, because now An understanding comes to you that Panchakarma is not the answer for everything. There are many different ways that we can take care of procedures, and Panchakarma is not the only answer. Yeah, I hope that answered your question, Debanti. Yeah.
So I have a question.
Yes.
So at what stage do we have to consider doing Panchakarma? If like, been taking herbs for a long time, for various reasons, maybe like different intervals. So at what stage should, the consideration be made to decide, try Panchakarma or, not?
Right. So it is the practitioner who has to decide first that the client is either ready for Panchakarma or not. So here's what happens for me in my clinic. When a client comes to me and they say that I want to get a Panchakarma done, I would definitely tell them, okay, let's assess and see if it's even necessary or not. Because I don't want to do a surgery if it's not necessary to begin with. That's the period. That's what I say. Because of our own sattva, right? And our own time-taking process and also expensive, all of that. I take all of that into consideration. And I tell them, okay, let's start with doing this. Let's start with your diet. Let's start with your lifestyle. Let's start with Pachana and Deepana, Anulomana, which is bringing things down, and then see what the symptoms are. And if at the end of 2 to 3 month period, I do see that they are going in a right direction, where they are achieving their goals, even without getting their Panchakarma done, then Panchakarma is not necessary. Then I tell them it's not necessary.
Okay.
However, if after the 2 to 3 month mark, they are going in the right direction, but they're going very, very slow, they're treading very slow, then I say that, yes, you have reached a stage where you're able to handle Panchakarma. I could do Panchakarma for you now. It is actually necessary for you now because it is not possible for you to maintain these restrictions all your life. For you to be able to feel better, there is a possibility that you might have to follow these restrictions all your life because of the chronicity of the condition, because of how much you're exposed to in the past, because of the amount of toxins that are present for various reasons. You will have to follow this strict protocol for several years now. That is not possible. Because it's not possible, I want to offer that we will do a Panchakarma now so that we can do removal of the maximum of the doshas, and then it will be easier for you to follow the protocol later. Again, Neeta, very important to remember that with Panchakarma, we will not be able to remove all the toxins out.
Okay.
We can only remove the toxins according to the strength of the client. And we might have to do Panchakarma. Sometimes in skin conditions, we will have to do Panchakarma every 6 months also.
Okay.
So that's why I also always tell them, according to the sattva of the client, according to the feasibility of the client, according to the strength of the client, taking all of these into consideration, then the practitioner would have to determine. I give them, okay, this is plan A. If you follow this, then it takes these many months or these many years. This is plan B. If you follow this, this is going to be these many months and years. Now, this is your decision. You make a decision what you want to do according to your own resources, according to your own time.
Okay.
Yeah.
Yeah. Thank you.
Yeah, and that's why it is important to make that call that, we have to be explaining why it is necessary and why it is not necessary also. That way, the client is able to make a decision at that point. Yeah, good. Now, moving on to Basti, which is a favorite one. It's my favorite one also because I feel like it's a royal treatment. You don't have to follow a lot of these restrictions. You don't have to take that medicated ghee because taking that medicated ghee is not the fun thing in the morning. I mean, you have to wake up at 6 or you have to wake up at 5 in the morning. You have to shower, your bowel movement, all of this is done. Then you drink that bitter ghee in the morning and then you wait for the burps all day long. It's not a fun procedure at all. Versus the enemas, you happily have to just come to the clinic at 8 in the morning or 9 in the morning, get a full body oil massage. And here also there is sneha, there is also oleation. But the oleation is done via your rectum. the oil, medicated oil, is given via the rectum. Because, and again, Vamana, I did not tell you this, Vamana is done when there is a lot of kapha, when there's a lot of mucus. Because we know that the kapha is much more in the upper area. All of this area is a lot of kapha. And Virechana, which is loose stools, is done when there is a lot of pitta. Rakta dushti or pitta dushti is there, then we conduct Virechana. So if Vata dosha is more, if Vata dosha is not functioning the way it is supposed to function, then we perform something called basti. Here we have to give something via the rectum, not something, medicated oil via the rectum. And this is how the oleation is happening. Instead of drinking, instead of from this route, it's going from the other route. Oleation is happening. Then for 2 to 3 days, we create the oleation. We see what time the oil is coming out. What are the symptoms that the client is experiencing when the oil is coming out? And then on the 3rd day or 4th day, we give something called a decoction. And it's made with a decoction and oil, honey, salt, medication, so many different things are made, and a concoction is made. About a liter concoction actually is made, and it's given via the rectum. So a lot of the old toxins, old poop, all of that will come out. Your cleansing of the large intestine is going to be happening. And especially that's where Vata is stored in that area. And all of that will come out. Then we give oil again, then decoction again, then oil again, and decoction again. Normally it's an 8-day procedure. Sometimes it can be for 15 days as well. Sometimes 21 days as well. And this is given especially for perimenopausal or menopausal women because of the pelvic area where you carry all of these toxins that are present, and Vata is of dushti, especially if there's fibroids or there's cysts, or you are placed for hysterectomy or hysteroscopy, all of these. Then we do these procedures to remove the toxins that are present in that area. Or even neuromuscular conditions. People come to us with a lot of different neuromuscular conditions where they're posed for surgeries as well. When there's a disc prolapse or disc bulge or sciatica or herniated discs, any of these conditions as well, it is happening because, Vata is responsible for movement. Vata is responsible for if a balloon is here, it maintains the proper shape of the balloon. But if Vata is deranged, that's when the disc bulge can happen. That's when the disc prolapse can happen. So now creating Vata and keeping it in the same track is what is done. Even arthritis, osteo or rheumatoid arthritis, any of these conditions, enema is given so that a strength Vata is arranged in a proper way. So that is enema. That's the 3rd one. Now, 4th one is the raktam or nasya. We'll talk about nasya. Nasya, there are 2 types of nasya. Shamana nasya and shodhana nasya. The nasya that we do every day, just 2 drops into each nostril or 3 drops into each nostril is just shamana nasya. Here, we pour 16 drops into each nostril. And if 16 drops is not enough, 32 drops is also given. Especially with allergic rhinitis, asthma, or any of these accumulation, congestion, all of deviated septum, any of these particular reasons, usually Nasya is not done as a one treatment. It can be done after Vamana or Virechana. After the client has recovered from Vamana or Virechana, then we would give Nasya. So Nasya is the practitioner will help the client get it performed. Again, we're legally not allowed to instill anything. We will allow the clients to instill themselves. We will have to help them and pour 16 drops into one nostril, 16 drops into the other nostril, wait for all of the gunk and the mucus from this area to get collected into the throat, and then they spit it out. And then we give herbal smoke for all of that mucus to get collected. So all of the mucus that is present in this area is removed. That is nasya. Then rakta mokshana, which is bloodletting, what Debanti was interested in. If there is, any of the shingles, especially anything that is localized, which your rakta, which is your blood, is vitiated, and you've experienced varicosity in the veins, or shingles, or any localized eczema, or gouty arthritis, these particular localized rakta dushti, or even warts, for all of these, there are two ways that you can do rakta mokshana. One way is just like cupping. This is exactly like cupping, where you put alabu. I mean, alabu is something that is mentioned in Ayurveda, like the loki. You cut the loki internally and then you make it into a cup, and it seems that they used to do it in the past. The cupping was also present in Ayurveda. So here you get the leeches, medicated leeches. Leeches have the ability to suck out bad blood, and it will be only this much, and then it will actually be swollen up into 4 times its capacity, drinking and sucking blood. And mind you, it is not at all painful. It sucks out very, very easily. It has the ability to remove just bad blood. So all of these problems that you're experiencing will reduce, and then the practitioner would have to suck the blood out of the leech. If not, it will die out of toxins. So to remove it out of the leech, or the other way is with just donating blood. What I tell them, I mean, anybody's experiencing itching, or they're experiencing eczema, what I tell them is, if you're able to donate blood, you drink about 10 to 20 ml of ghee, medicated ghee, so that you get some energy. And then I ask them if you can go ahead and donate just blood. Or usually, if you're able to, you're going to be able to draw blood from that particular vein, the closest vein to where you're experiencing any of these situations like varicosity or eczema or itching, or any of that is a possibility. So that way you're going to be removing bad blood. Now, with all of these 5 techniques, it is important right after the pradhana karma, right after you do all of this, you have to make sure that you give proper food later on, because they don't have enough digestive capacity to introduce food immediately after Vamana Virechana, especially. There is something called Samsarjana Krama. Samsarjana Krama. You have to introduce just rice soup or mung soup right after Vamana and Virechana, because with the vomiting and with the loose stools, the digestive fire is also gone. So you have to introduce, it's like Annaprashana. You have to introduce slowly, like the thin rice soup, then a little bit thicker rice soup, and even thicker kanji. Then you give very mushy rice. Then you give rice and rice and dal separately. So you cannot start, because right after doing Vamana or Virechana, or doing Vamana and during all of this period, it's very, very important to follow a few things. You cannot be traveling too much. You cannot be talking too much. No sexual intercourse. You cannot be sleeping very late in the night. And you cannot be making any important decisions also, because your mind is not functioning the way it is supposed to function. No exercise. Not even vigorous pranayamas like Bhastrika and Kapalbhati. These kind also you can, because what you're trying to do is you're trying to create a pressure gradient. It works by diffusion. You're bringing all of the toxins that are present in the extremities into the big well, which is in the abdomen. Now, if you travel, or if you talk too much, or if you create vata, then it's going to go back to its own place. So the purpose will not be served. That is why it is important not to aggravate your vata with any of this. And you follow all of this and do not eat excessively. Now, what happens right after Panchakarma, when you do, especially in overseas, you travel immediately, no? You've just doing Vamana and Virechana, we told that you will get 20 loose stools. Doing that, you're already aggravating your Vata. So this Samsarjana Krama, this level of, it's like traveling right after you've had your surgery. That's that, you know how much weak your body is going to be at that time. So you have to nourish your body very, very slowly and allow it to get to a stage before you resume your normal activities. I ask my clients to get no gym, no personal training, no activity during that time, not even pranayama during that time. Just meditation is okay, but not even pranayama during that time. In the olden days, you'll be surprised. It's called Kuti Praveshika Panchakarma, which means this person will go into a small kutir and there is no fan, no light, no communication with anybody. They are just going internally, inwards. They're staying there for 30 days. Just like you're in the jail, your food will be slid inside. So that is how you're actually supposed to do your panchakarma. If you do your panchakarma like that, then all your toxins will be gone. Then after that, you're able to take proper rasayana. Then you take chavanprasha. You stay there also and you take only chavanprasha as food, as rasayana. Then you come out as a youth again. That is how Rishi Chavana, Chavanprash came from Rishi Chavana, who loved this young woman and he wanted to become young again. That's when this Chavanprash was invented actually. So he did this Kuti Praveshika kind of Panchakarma and then he ate Chavanprash as his food. But then imagine how much of mental power it takes to just stay inside this small hut which does not have light or fan or no communication with the world at all for several weeks before you become youth again. Right? So we cannot do that. So we're creating alternatives for that. And these are the alternatives that are given now. So with this alternatives, it is important to remember that we cannot remove all the toxins out. And it's also important to remember that because you've done such hard work, you have to remember what is the food that you're putting inside your body. I sometimes show them their invoices, how much they paid for their Vamana and Virechana, so that it will motivate them to follow their food chart or food guides later on. Right? Because we think that I just go somewhere, get my Panchakarma done, and then I can do whatever I want to. No. Important to remember that only if you follow what you're supposed to follow after the Panchakarma is done, yes, you have done the hard work, but maintain this hard work. So if you or your loved ones are ready to do all of this, then you're welcome and do Panchakarma. If not, no, let's just do Shamana, let's just do Upakarmas. So many different things are available. So Panchakarma is not even necessary. Right? I know we're at 7:28, so I'll stop here. If you have any questions, we can take one or two questions. But I hope this was informative for you about Panchakarma. I know everywhere it's like a thing that, and people ask, oh, there's a Panchakarma center here. I used to always go to India every year and get my Panchakarma there. Right? So for all of those, at least I hope that you're enlightened today about what Panchakarma is. Pigmentation issues, absolutely, Baijanti. It's a difficult one. It is not easy at all, especially melasma, pigmentation. You have to make sure that you do proper Panchakarma. Virechana is necessary. And even Rakta Mokshana actually is very, very beneficial for pigmentation. After you cleanse out, then you give rasayanas, internal rasayanas. So that is possible. But I'll tell you that that pigmentation is one of the difficult ones that I have noticed. Yes, thank you, Debanti. Yes, uncle, you can ask question. You're on mute, uncle. Okay, let me just unmute. You can unmute yourself. I have asked you to unmute. I am not able to unmute you. I can only ask you to unmute. Okay, I think you are unmuted now. Yes, you can ask your question now. No, you're still, I can't hear you still. You're not muted, but I still cannot hear you. Maybe you're talking, maybe your output is from a different place because you're on your headsets. Yeah. I'm glad, Karen. I'm glad that you've attended.
Oh, are you able to listen?
Yes, yes. I can hear you now.
A mistake is there.
Yes.
I want to talk to you after completing all other people, so
Yes.
that I'm waiting for that. Is it okay?
Yes, absolutely. Absolutely.
Okay. So that I will not disturb others.
Yes, absolutely. Good.
Thank you so much.
Yes, absolutely. Thank you. Thank you for attending. And then
Thank you, Manjuji.
absolutely. So, suggest a topic for next time. And I know we can probably continue. We were going to do women health again, if you want to do women health again, because we wanted to do a extension of what we did last time. So we could do that. Okay, good.
Thanks a lot for the informative session.
Absolutely. My pleasure, Nita. Thank you for attending. Yeah. Next time we'll probably continue women health then. Unless you all think if there's any other topic that you suggest, we'll do that. I'm going to stop the recording now. I hope I was recording. Yeah, I can stop.